My name is Dr. Wang. I'm the medical director of the older adult program at Caron Treatment Centers. Our medical department at Caron Treatment Centers consists of multiple addiction medicine board of physicians, including 2 nurse practitioners, 2 addiction medicine fellows, attending physicians who are not only board certified in addiction medicine, but as well as other specialties such as surgery, anesthesia, and psychiatry. The nursing services provided on the older adult program are dedicated to this population only and separate from the remainder of the campus, and understands their needs, and not only from a physiologic and medical standpoint, but also from their cognitive and emotional standpoint. Withdrawal management from various substances for older adults are rather different than younger people because of their specific physiologic differences. Older adult tends to come with more comorbid medical conditions that complicates the withdrawal management process. The older adult program at Caron Treatment Centers, we are capable of the care of severely compromised older adult patients, not only from a medical standpoint, but also from a cognitive and physical standpoint. Many of our older adults come in severely compromised, secondary perhaps to their substance use, but also of their underlying medical issues. Due to the deconditioned state and the frailty of many of our older adult patients that come to treatment, we are fully mindful of their ability for daily ADLs and self-care. We provide all of our older adult patients at the time of their admission, one-to-one personal care aid to assist in any ADL needs and also to reduce risk of a fall.
My name is Sharon Matthew, Clinical Director of the Older Adult Program at Caron Treatment Centers. What we found years ago is that there were more older adults coming into treatment, and we gathered a group of them together, 65 on up, and immediately they liked the commonalities. They had had careers, they had raised their families, they sometimes had grandchildren. So that social aspect of the program was really important. They felt more comfortable, they felt more trusting. Treatment for this group is different from others in that it's a slower pace. People come in quite compromised, sometimes physically, so they might be on a wheelchair or walker, cognitively impaired, they might have some memory issues as a direct result of their use. So we start slowly, we meet them where they are, and it is also a treatment that we developed out of dignity and respect, because that's what this population requires and demands, actually. This is also why we need a 6-week length of stay, because it does take longer for them to sometimes join in and rebound. The testing process for the psychologist is really important. What she will do is a battery of tests to see how they are functioning, what their memory is like, what the cognitive abilities are. Routinely, the initial screenings are repeated about 3 weeks in after they have gotten more clear, after they are through their withdrawal process. The features of NEAG are so conducive to our program. All of the treatment is delivered here. I call it one-stop shopping. The doctors are on the first floor, we are on the second floor, elevator access to all floors. The lower level is where we do our groups. And physical therapy is on the first floor. Massage is actually on the second floor. In the NEAG Center, we have our own dining room as well, which is extremely beautiful and has numerous selections for all 3 meals. The rooms are all ADA compliant. Everyone has a call button in either the suite that they're living in or in their bathroom. The hallways are very wide for that reason, because we oftentimes do have several people in wheelchairs or walkers. The rooms are all suites, so there are 14 single rooms, and then we have 1 room that's a double in case we do get a couple. We do treat couples, which is awesome. The bathrooms are all European bathrooms, so that they can actually, if they're in a wheelchair, they can roll right into the shower. Everything is ADA compliant. There are numerous co-occurring issues with this population. Oftentimes it's anxiety, depression, chronic pain, trauma. And what we're finding is this population is one that has not talked about some of their issues for many, many years. One of the large components of treatment that we do is grief and loss. This population is one who has suffered not only the loss of a loved one, but also loss of possibly mobility, loss of time, loss of their careers if they're retired. Chronic pain is a major focus of this older adult population as well. So what we're trying to do is non-addictive pain medication treatment for this population. Physical fitness is really important to this population. Patients are able to go to the beautiful gymnasium, which is actually right next door. We have a serenity walk that we take them on as a therapeutic method as well. Movement is the best thing they can do. But then we also have a nutritionist who meets with every older adult actually when they first come in to see what their nutritional needs are. Do they have a special diet they adhere to? We now have a family therapist on older adult, which is great. That person will be working with the families about the work they need to do for themselves. We have a signature family program, family education piece, and then we follow up with a family session via WebEx with those family members who attended and the patient. Family calls are done once a week by the therapist, but then also with the family therapist, he also calls them as well to help walk them through any of their anxieties, their fear, again, redirecting them to focus on what they can do for themselves. Some of the other treatment modalities we use for older adults is dialectical behavioral therapy, DBT. Additionally, we can also offer EMDR. There's certain therapists on campus who are trained in that modality. Our motto on older adult is life worth living, purpose and quality of life. We are here to give that back to them. What is going to have you get up in the morning? What's going to get you up and moving now that you are sober and in this stage of life, what is next for you?